There's no question that a crisis like this one can cause even the strongest person to feel upset. And if you're struggling mentally or emotionally, you should know that you are not alone. Dr. Nazia Ahmed, Associate Medical Director for Palo Verde Behavioral Health, is here to discuss. Doctor, it's great to have you on. And what do people do if they're having a mental health crisis during these difficult times?
Thank you so much for having me here today. As we know, infectious disease outbreaks such as the novel COVID-19 has created a significant amount of distress for the population in the community. There's a lot of uncertainty and fear associated with the nature of the disease, its spread, its scope, and its impact on individuals. Some of the concerns that people will focus on are personal and family safety, fear of infection, impact of isolation and quarantine, and alteration of their work and life balance. What we see is that this can lead to emotional distress and can manifest in conditions such as anxiety, depression, PTSD, increased risk of unhealthy behaviors, which can include consumption of alcohol, illicit substances, tobacco, as well as risk for marital conflicts and domestic violence. I think it is really important that we focus on mitigating these strategies and risks and how we can reduce the distress associated with this. One of the important things that we need to do is acknowledging and normalizing the distress reaction. We can stay prepared, stay connected, especially to our primary support system, such as family and friends, keeping ourselves informed, keeping our immune system strong, eating healthy, eating on time, routinely sleeping on time, exercising, and practicing coping strategies that may help reduce that distress.
Yeah, and when someone is admitted to the hospital, the big question is, will family members still be able to visit them?
So with several months of awareness related to the COVID-19, it is more critical than ever that we pay close attention to best practices and guidelines set forth by CDC and local health agencies. So at this time, we have suspended our visitations to limit any potential exposure for illness to patients and staff. We, however, have arranged alternatives via Zoom, so patients are still able to visit their family virtually online, and that ensures the safety of patients and our staff.
Yeah, I think that virtual meeting space has really become a part of all our lives. And, you know, we've heard the expression PPE, personal protective equipment, a lot, and how it's in such a shortage around the country. Is Palo Verde Behavioral Health accepting PPE right now?
Yes, while at this time we do have adequate supplies that are needed for our staff and our patients, we do expect a rise in COVID-19 cases based on key projections. So therefore, we are accepting donation supplies from any local vendors or industries, such as masks, gloves, wipes, any kind of hand sanitizers, protection gear, or gowns.
Yeah, so important to keep those that are making us healthy again, keep them healthy, keep them safe. Talk very briefly about the outpatient services that people can take advantage of.
Sure. We have a very robust outpatient program that includes partial hospitalization and intensive outpatient care. We're continuously working on a telemedicine platform to provide care for patients beyond the physical walls in order to implement their needs for mental health treatment. Our partial hospitalization program and our intensive outpatient program has transitioned to telemedicine at this point. We have groups associated with trauma recovery, perinatal mental health, substance use disorder, and we have psychiatrists available to provide medication management during those programs. We also do medication management for TRICARE patients, active duty, veteran population.
A lot of essential information for everybody at this time. If ever there was a moment to take care of your mental health, to check on your loved ones and make sure they're doing okay, and if they're not, then to get the appropriate help, that time is now. Doctor, thank you so much for joining us. And if you'd like to learn more about Palo Verde Behavioral Health, visit paloverdebh.com or call 520-322-2888.